Ladies, pack your hoe bag.
Who you calling a hoe?
Pour up a drink and start.
That's a little kinky.
Hear it.
Streaming 24/7 across all platforms.
24/7.
Yes, sir.
Live on sayitloud.com. Lock it in.
Y'all keep it locked right here.
It is another episode of Say It Loud. Happy Friday, guys. And today, my guest in the Say It Loud hot seat is Nicole of Pivotal. Is it Pivotal Performance?
Yes.
It's Nicole of Pivotal Performance. I invited Nicole to the show because I felt like, again, this was an opportunity for us to learn and have discussion about things that we don't really talk about, or maybe some people are uncomfortable or ashamed to talk about, but we need to talk about it. So Nicole's here and is just going to bless us with some information and share and be our go-to person for all things that kind of relate to our pelvis, right? It'll be like the pelvis princess preacher or something like that. I don't know. You'll be surprised on Instagram the things that people specialize in, but we need people to teach us stuff like that, because it's not until we're in some kind of situation that we're like, oh my God, I need to find a doctor or a therapist that does this. So Nicole, welcome to Say It Loud.
I'm so glad to be here. Thank you so much for having me.
Can you tell everybody a little bit about your company and what is it that you do?
Sure. So Pivotal Performance specializes in women's care. I am an occupational therapist. I've been practicing for 11 years now. The last 4, I actually decided to specialize in women's health. I kind of decided to do that after I had my own pelvic floor injury. And I didn't realize that I was having actually a pelvic floor injury. When I started, I was working about maybe 3 jobs, right? Because I was in the middle of trying to put everything together for Pivotal. And I decided I wanted to be a business owner. So I started having back pain. And then the back pain went to kind of like a burning sensation down the back of my legs, like almost like sciatica. And then from there, I was back and forth to the doctors, like with symptoms of having a UTI, but every time we used to take a urine test, it was negative. So because I, was going to school also for pelvic floor therapy, I started paying attention to what I was going through. And I started realizing that I did, in fact, have a pelvic floor issue that probably even went back to when I gave birth to my son, which would have been 11 years ago.
Wow.
Then when I started thinking what I felt during the pregnancy afterward, and then kind of like a little bit all through life, it just totally fit and made sense. So I didn't treat it back then. And then eventually it just got really bad and just got worse. So after that, I was like totally on a mission to like boost women's health, because I went to every single doctor known to man, had every test done, but my symptoms weren't changing. So I felt, it was devastating. Like it even got to the point where I was having pain with sex.
Right.
And being married, that's a huge strain in all types of levels,
Yeah, definitely.
So I didn't want another woman to go through what I have gone through. So I wanted to offer. So that was my drive for like establishing Pivotal.
I think that's amazing, because I think a lot of women experience that. And they might not know, like you said, it's like, oh, well, I had my baby 6 years ago or 10 years ago. I mean, this always kind of happens, right? And not thinking about it that, no, maybe there was some type of injury during that time. And now how do I heal? How do I make that better? So what are women looking for when it comes to that, as far as like symptoms?
It definitely, like, It's hard to say, right? Because the pelvic floor actually is responsible for so many different things. So, what I usually kind of help bring awareness is more like busting the myths, right?
Okay.
So, we're kind of told that at a certain age, or if you're pregnant, it's acceptable to urinate on yourself or lose urine if you have to.
Yeah.
But there's no reason for that. Like, even a pregnant woman herself, if she is becoming incontinent, it is a muscle issue. There's a weak muscle that is allowing the urine to actually pass through when it's not supposed to. Or she's having like a pressure system issue where she can't manage her pressure in her body and it's just slamming on the pelvic floor. So I kind of chase it from that end, like trying to educate them, like the things that you think are normal are
Mhm.
not, because half of my patients, I'll ask them, have you ever lost urine before? And most of them will be like, oh, no, never. But then they'll be like, well, sometimes when I sneeze, a little comes out, but that's not normal.
Right.
That's not our norm. That actually is signaling that there's something else that's going on within the pelvic floor. Same thing with pain with sex. Like, I don't know where the thought process kind of became into making it like the norm, but most women think, I guess, feel that it's acceptable to have some level of discomfort after intercourse.
Yeah, that sucks.
But in reality, like, it shouldn't hurt at all, you
Right.
know? You
Right.
shouldn't hurt during the process, you should not hurt after the process. All of those things are muscles within the vaginal area and the pelvic floor that could be tense, that
Mm.
are kind of being a little restrictive and causing pain in that way. So I kind of chase it from there, because sometimes when you tell people symptoms, they still don't make the connection,
Right.
right? So sometimes, like, I used to actually talk about low back pain all the time. So like with sciatica, for example, that's a sneaky one, right? So sometimes it could be, a problem in the spine,
Right.
but sometimes, and I would say a majority of the time, it's a pelvic floor issue.
Really? See, I didn't know that. I always thought sciatica was a back, just your back is, your nerves in your back.
No, sometimes, so there's different issues that can happen that will cause sciatica, right? So we have, like, in your glute, there's a muscle called the piriformis, right? Now that muscle can become very tense and start kind of pinching on the sciatic nerve. Now the piriformis muscle is actually, it makes up your pelvic floor.
Oh.
So if you're having tightness at either angle, you could be having symptoms like that. And it might come across as like just your typical sciatica, but it may not be. It may not be actually stemming from the spinal cord.
Really? I didn't know that. So what can women do to strengthen their pelvic floor muscle?
I like function. I am like totally into function. So it's become the norm or the go to for everyone to do Kegels,
Yes.
right?
But I'm all for Kegels.
But don't do them. I tell
Oh,
everyone, don't do them. It's so bad. So this is the thing, like, they have a time and place, right?
yeah.
But when people think they're having a pelvic floor issue, I think they get the vision that the muscle's just like very weak, right?
Yeah.
Half true. It is weak. But some people can actually have the muscle kind of like shorten and tense up. And then that's why they're having the symptoms. So now if you go ahead and do Kegels,
It's
you're
just
just
worse.
keep tightening, tightening, tightening a muscle that actually should be more encouraged to kind of lengthen.
That makes sense. So just like you said, like if someone feels like they're having pain during intercourse, and they're not, and that muscle's tight, it's going to be more painful versus somebody. Ah, that makes sense. Yeah,
right? So when
yeah,
you think like your pelvic floor, it does everything, right? It's like the hardest working muscle, I think. Um, it has to hold urine in, has to hold poop in, has to make sure that you're able to walk, bend, lift, right? And yes, we get the core, the back, and the hips in there too, but the pelvic floor is working just as hard. And it's responsible for your orgasms as well. So it's got such a multi-purpose job that, sad to say, but anything can just kind of go wrong.
yeah. I never knew how important my pelvic floor muscle was until just now. No, because you don't know, like, okay, well, what muscle does your orgasms come from? What muscle helps you walk and bend? And you don't really give that much attention to your pelvic floor, other than incontinence, right? Like you said,
Right.
or something, vague sexually, maybe. And even Kegels, you just only learn about that. I think a lot of people don't even know about that. I've had people say, like, Karen, what are Kegels? And I'm like, you're a whole grown ass woman. Are you serious? But you don't even learn about that. I only clap because I only learned that word when I had children.
Yes.
You know what I mean? So that's the only word I know related to that kind of exercise, because that's the only time someone teaches. Like, you don't learn that in high school in health.
No.
So the only time you learn it is during pregnancy, when you're reading, you know 9 months of, like, okay, what's going to happen to my body? That's about it. So I think that's another thing. There's like a lack of education around our bodies, especially as women, men as well, but especially as women, and like how we take care of our bodies, and what we know about it and what we don't know. Again, until we meet someone like you and we're like, by the way, I've been having this problem, and then we can sit and have a conversation about it.
Exactly. I want to actually make it more comfortable to talk about, because I find like certain topics like urinary leakage, pain with sex, constipation, no one wants to talk about. Like it's hard. And I get it, but it's normal function of life, right?
I mean, say it loud, we talk about everything. So,
Exactly.
I try to make this a space where we're having fun, but we're learning.
Yeah,
And there's things that, like I told you earlier before we started recording, there's things that nobody ever told you.
yeah,
And we don't have conversations about it, and then we're walking around as adults not quite sure what's happening to us, because we're kind of like embarrassed or uncomfortable to have conversations.
yeah.
And I think every day is a learning process, and I think we should be listening and learning, and that hopefully somebody listens to this podcast and is like, you know what, I've been feeling like this, or this has been happening to me, or every time I know me, every time I sneeze, I'm like, let me cross my legs, because and I haven't had a baby in 12 years. But that's just life.
It's common. Like a lot of women will start if you constantly feel like you have a UTI, but the test is always coming out negative. That's a very tall tale sign that there's something going on with the pelvic floor. If
Mm.
you feel the need to like cross your legs when you sneeze or cough, 100% that's something, because that's more of like a pressure system issue as well. So like think about like how you feel when you sneeze, right? You get all this pressure that goes right into your core.
Mhm.
Now, half of us don't have, the strongest core, right? And as women, I feel like it's very common because we're constantly like sucking in our stomach, right? You walk around, you sit, you stand, you're just constantly clenching. So when you do that, you're actually essentially making the core weaker, right? Because you're
Mhm.
constantly keeping the muscle in a shortened kind of position.
Right.
But if we were to go to the gym, right, and let's say do like a bicep curl, you would have to actually like let the muscle fully lengthen and then
Bring
lift
it back.
to shorten, right? But we're not doing that when we're clenching our stomach all day long. We're just constantly keeping it short. So we end up actually making the core very weak. So now you get this sneeze in, right?
Mm-hmm.
Your core can't handle all of that. So then it gets thrown right down onto the pelvic floor. So if you have like a full bladder, or not necessarily even a full bladder, if you have some urine there, the muscle may not be able to hold back,
Right.
and then it kind of comes with that pressure. So a lot of the times, like in therapy, I'm also working on like, how do you improve your pressure system?
How do you improve your pressure system?
It's really breathing, right? So like, watch, Karen, try this. This is fun. So
Okay.
take a deep breath. All right. I want you to like take your biggest breath. All right. You ready?
Okay.
What do you notice? What do you feel on you going up?
My chest, my shoulders,
Right?
my stomach, whole here is all going up. Everything's going up.
Everything is going up, right?
Yeah.
So when we take a deep breath, what should happen, right, is your rib cage should actually move out to the side. So it should look something like
Oh, let me try that.
this. So slow down on the chest a little bit, right? If you're actually clenching your abdominal muscles, let go just for this second, and you'll see how the ribs kind of give. So breathe in.
Oh, my stomach kind of gave too, Nicole.
It does. It does. So it's not just like rib breathing, right? A little bit of everything moves. You get a little bit of movement at your chest, your stomach, your back, and your ribs, right? But why is that important? So when you breathe like that, your diaphragm is able to actually move down. When your diaphragm moves down, you're able to take in more oxygen into the lungs a lot better. Your diaphragm actually communicates with the pelvic floor, right? So I kind of call it like a piston system.
Mm-hmm.
So every time you breathe, these two muscles move. So when you inhale, they go down. When you exhale, they come up, right? So when you have that pressure system, your pelvic floor is constantly moving. Like think about how many times we breathe,
Mm-hmm.
right? So it's constantly getting a chance to like lengthen and stretch out.
Right.
But now when we talk about like real life, like what we do in real life, we don't breathe like that. So the pelvic floor is not actually lengthening, right? So it's kind of always staying short. And then that's how you start getting like some of those pelvic floor dysfunctions, because we're losing that pressure system.
Right.
So it's interesting, right?
Yeah, I would have never thought about that. I thought we were gonna do some other kind of exercise. I didn't know, like, okay, I just need to breathe.
So I bring it back to breathing, right? Because that's the core, right? Because think about like what you're gonna do. You're gonna go into the gym, right? And you're gonna start working out.
Mm-hmm.
Now, if you don't have a good pressure system,
yeah, none of it's gonna work.
Yeah, you're not going to be like really supported. So usually I go through the breath first, right? Get that down packed. Then we go into like therapy and we start kind of, if you need help to lengthen the muscle, then we do manual therapy to do that. Or if you need help to kind of strengthen the muscle, then so it really depends. Like, well, all my sessions actually depend what the woman is going through.
Right.
What her goal is. So like I've been known to run with my clients, right? Because if they want to run and they want to get back to it without
you're a good doc. You're a good therapist.
we go for a run.
I'll be waiting right here when you get back, but okay.
Oh, I'm half the time I have to like do the slow run because I'm not
I mean,
I'm not
but
a
you
runner.
do it. But you do it. I
I'm
mean,
not
that's motivating in itself. I don't know. I feel like that's amazing. I don't know if I'll do that, but it's amazing. So running actually helps.
It does when you have a good pressure system, right? So I teach them, like, I kind of take a different approach to pelvic floor, I'll be honest. I look at a person's whole entire body, right? So ankle has a lot to do with how much pressure your pelvic floor actually has to kind of do or engage. So
Really?
I will check range of motion on someone's ankles. And if I notice that they're missing something or there's a weakness there, then I will help them to get that stronger. So that way, when you're standing, now you can have better support on your pelvic floor. So I kind of
Hmm.
work with the whole body. I don't just stick to one
One
specific
area.
area, right? Because it is like a chain. Like you can't really cut up the body. It's kind of all related.
Yeah, definitely. Let's talk about poop.
Okay.
No, because like people have to shit and they don't talk about it. They don't. They
No,
don't
it's
talk
my
about it.
favorite subject, actually.
It's
It really
really
is.
uncomfortable. I make jokes about it all the time, Nicole, because I stopped eating meat. Today
Okay.
is 38 days. Yeah, 38 days. I've
Ah,
given up meat. I was reading a book called The Sacred Woman, and
okay.
it said do a cleanse for 21 days. And I was like, I bet I'll challenge myself. And at 21 days, I was like, you know what? I'm gonna keep going. And so it's been,
Oh,
yeah,
good.
it's been good. I'm still full. I've lost about 8 pounds,
Oh, nice.
and I am in fact not full of shit. No, I know this for sure. I'm pretty sure because since I stopped eating meat, I think I go to the bathroom way too much. I was like, this can't be normal. This can't be normal. And then my family was like, but all you eat is fruits and vegetables now.
So
And
it
I
is
was like,
normal.
yeah, I like eat fruit for breakfast. I eat like today I had like salmon and sweet. I eat fish. I have salmon and sweet potato for lunch, and then like dinner I'll eat a taco, but it's got like rice in it and beans and stuff like that.
Uh,
I don't eat any meat outside of fish. And
wow.
maybe like Beyond Meat. I've had Beyond Meat a couple times, but the calories are really high, so I don't eat it as much. And I don't like the texture of
That one,
tofu.
the Beyond Burgers, I think.
Yeah, they're decent. They're decent.
They're not bad. I have a
But
weird diet, so I gotta eat all those weird things.
so, with that said, I noticed a change in my body and me going to the bathroom. I was like, Mom, this can't be normal. Like I'm going to the bathroom a lot more regular. It's not bad. It doesn't even hardly smell. Not, like not, I mean, it's still shit, but it's not like, oh shit,
Right,
and,
right.
you don't need to burn the incense or nothing. And I noticed the difference in what I was taking into my body. But I want to talk about constipation and how it affects your pelvic floor. And is it the same for men?
Yes. So men experience pretty much the same things that women experience. They have a pelvic floor, so they can leak urine too. They can experience pain with sex. They can
Really?
have a hard, oh yeah, they can
I
have
didn't know that.
a hard time having an orgasm as well.
Really? Is it painful for them or just having a hard time having orgasm altogether because of different muscles?
No, sometimes it can be painful. Like,
Really?
yeah. They have
Oh,
a pelvic floor just like us. Just I honestly I feel bad. Like soon I am gonna really start like marketing more to men because they do have a pelvic floor and they go through similar situations, but they don't have support either.
well, I think the culture we're in is like I said, we talk about it when a woman's pregnant. That's about the only time we talk about it.
Yeah,
But I feel like we don't have that conversation for men. You
never.
know, we don't have the conversation about them having a hard time having orgasms. We don't have a conversation talking about your prostate. We don't have a conversation talking about your muscles in that region, like you said. And also like when things like that do happen, it's almost taboo, right? Nobody wants to be the guy that is incontinent. Nobody wants to be the guy that can't orgasm. Nobody wants to be that guy. And so men walk around, I think even more than women, with a problem like this and don't say anything.
Yeah, it's true. It's true. I mean, honestly, I would like to bring the conversation to be more comfortable to talk about, and to not feel funny because, when you don't talk about an issue, people suffer, right? Because it
Right.
never gets fixed.
Yeah.
You know,
Yeah.
you
And you
you
can't, you don't get help if you don't tell anyone.
right. So
All right.
yes, I
So back
can
to the poop.
do that.
Back to the poop. Because I feel like when you're a new mom, everybody talks about poop, right? Did the baby poop today? How many times they? And
Yep.
then we get old. Nobody wants to talk about poop. So let's talk about constipation. Is that something linked to just your pelvic floor, or is it also your like diet and exercise?
It's a mix. I'm going to be honest. For some people, it can be just a matter of drinking more water. You know, I think we don't drink enough water. Like in a day, someone should drink at least 6 to 8 cups of water at minimum,
Right.
right? To have good, healthy bowel movements. And then I think too is like we also don't really eat like diets that are high in fiber. So a lot of people are very heavy, like, on the carbs,
Mhm.
or even if you go heavy on the protein, that can constipate you as well. You
Right.
need some kind of, fiber, in that diet. But then there's the other side of it where the muscle itself can be very tight, and this could happen, at your actual pelvic floor, or
Mhm.
it can have, right at the rectum itself.
Right.
So if you think about, what the rectum exactly is, it's a sphincter, right? That has to open and close, which you control.
Right.
And for some people, they may not be able to control their sphincters.
Interesting.
Right? So it might be harder for them to kind of push. When I see patients, especially, because I always ask about poop. That's like my interview question. It really is. And I have a diagram with the different types. So I'll ask them like 90% of the time, how do you poop? Right?
Yeah.
Because people will tell you that they're not constipated, but then they'll have like a Bristol stool type like 2 or 3, which is actually suggestive of constipation. So
Oh.
I think sometimes people don't always realize, like they imagine constipation to be like very straining, very draining process, not realizing that it could also be like the quality of your stool, right? And maybe in fact, you are straining a little bit and you don't notice it because this is just the way that you've been pooping since you were little.
Right. They're just
But
used to it.
exactly. So I go through the whole thing with them. There is something called a squatty potty. I don't know if you heard of it.
No.
No? So
No.
it's
What's a squatty potty?
oh my God. So I love this thing, right? I recommend it to everyone. It's a stool. And when you poop, see what happens is, right, when we sit on the toilet, your hips are literally at 90 degrees, right? It's basically
Yes.
like if you were sitting on any chair.
Right.
So if you think about where you poop, we don't poop in a chair, right? So there must be something in the biomechanics that kind of helps us to not recognize that as a place to poop.
Right.
So the proper positioning for poop is actually in a squat position. So if you think about like, remember when the kids were small and you were potty training them? Before, they're still going to the bathroom in the diaper, they often like squat somewhere and hide. And then that's how,
Mhm.
right?
Yeah. Yeah.
Because they
Yeah.
know that physiologically this is the easier way to poop.
Right.
But then you put them on the toilet. So
Yeah.
when
And
we
we reprogram them.
toilet, exactly. So now it's like they're using more of their abs, right, to push the poop out. Some people actually hold their breath. while
Yeah.
they're pushing, so right then and there, as soon as you hold your breath, you just don't have no communication with your pelvic floor at all,
Right,
right?
because we just practiced that. So you're just like cut that off.
Exactly, just really
Oh, you
cut off.
see? You learn something
You're
every day.
trying to squeeze some poop out. So I usually tell them to use a squatty potty. It's great because it will put your legs in a position of a squat.
Right. So that, yeah, because if you think about gravity, that'll help.
Well, what it is like, so you have your bowel, right? There's a ligament that goes around, and then when you are in that squat position, it helps to bring the bowel so it like comes straighter instead of
Right.
on a curve. And then it kind of helps the muscle to realize what's going on, that it needs to like lengthen and relax. So it's kind of like a whole process that has to like occur that doesn't occur when we,
Right.
because we're either not using the right technique or we're not even in the right posture.
Yeah, nobody ever knew that till today, Nicole. Like, nobody that's ever listened to the pod, because you just feel like I gotta go shit, I gotta go shit. You're not thinking like, okay, there's a method to how I'm gonna sit on the toilet. While you were saying that, I was like, where were you? You sure you don't want to be a doula, Nicole? Because like I was just sitting there thinking, like, where were you when I was having this baby? Because it felt like I had to shit. That's what it felt like. And they're like lay in the bed, and I'm like, I want to go to the bathroom. I know what this feels like. I want to go to the bathroom, and you can't go to the bathroom. But I
No,
think the baby would have came out a lot easier if I was on a squatty potty. I'm just saying. We need to talk about this. We need to talk about
no,
it.
there's a bunch. So like with my pregnant moms, right? Um, because don't forget, like I'm treating people through all walks of life.
Mm-hmm.
So sometimes for like my pregnant patients that come in, yes, I am treating them for whatever they're going through, but we also cover like different birthing positions that are a little bit more friendlier to the pelvic floor, or even how to push, how
Yeah.
to push efficiently, like so that you're working with your whole body instead of like working against it. So
Yeah. Someone
kind
should have told me that the first time I had a baby, because they're like, push.
of
So I was like, okay, I'm gonna poop, and they're like, you're doing it wrong, and I was like, well, I never did this before. Like, what do you want? What do you want me to do? And the doctor was like, you're doing it wrong, and I'm like, well, how am I supposed to? This is all I've been doing. Okay, so I don't really know. So I do feel like that should be a conversation that can be had, and then there'll be less damage to your pelvic floor muscle.
I think it's important. Like poop is a big factor when it comes. Like I would say I never really did like the percentage of patients, but it is a common factor that they all share.
Really, that's interesting. Let's talk about leaking during pregnancy. Is that normal? I know you spoke about it quickly before, but because a lot of people say, well, oh, I was carrying the baby and the baby's low and the baby's heavy and I gotta pee every 5 minutes. Is that normal? And should we just be okay with that, or how does that work?
Some level of it. So yes, the weight of the baby there, especially positioning. So if the baby is very close to like where the bladder is, then yeah, you're going to get that sensation that you have to urinate. But to actually lose urine, no, that's not normal. Because if you think about it, right, our body knows that we're basically made to get pregnant, right? We're made to house this baby. Your muscles know what to do in that process, right? So if the muscle's weak, and I try to explain this all the time, so a lot of people will say like, I got my pelvic floor injury because I was pregnant. But when we start asking questions like 10 years back, there was something there. And then now we
Yeah,
had this baby. So it was kind of like the straw that broke the camel's back, shall
right.
we say. So now you realize that you had a pelvic floor issue, but before there was stuff there that was kind of like suggestive that there was something underlining going on. So yes, pregnancy should not leak.
Excellent.
That's
Well,
not
okay.
normal.
So, ladies, if you're listening to this, what about at any age? Is it, you know, I know we talked about a lady earlier. Is it normal at any age, or is that just like something that happens when you get old?
It's not, it's a complete myth that it's associated, that it's normal for aging person, right? So I actually helped a 92-year-old stop leaking, and we threw out all her diapers. You know, it was great.
Yay!
So happy. She was so happy. She was so happy.
Yeah.
It's a muscle thing. Like if you go to the gym, right? Like anything else, you're gonna work out muscles in your body. Your pelvic floor is your muscle too. You know, it's the most forgotten muscle, but it's still a muscle. So no, it should never, you know, be said that because you're old, it's normal for you to leak urine. No.
All right. So the next question is pain during sex. We talked about that really quickly. Is that normal? And then what are some of the reasons for the pain?
Not normal. at
Okay.
It's usually suggestive of muscle tension in the area. Again, I go back to like that breathing, you know, because a lot of the times, like if these two muscles are supposed to be functioning together and then they're not, then your pelvic floor is actually staying in a shortened position a lot longer
Right.
than what, you know, and we know that if you're not moving a certain way, we will lose range of motion. You know, those muscles will continue to stay short. So I don't consider any form of pain with sex normal, um, or acceptable. And even to like the most minute. So this is kind of interesting. Like most women think that even touching the vagina sometimes, if it's a little bit uncomfortable or maybe like it feels a little bit more in that area, that that's normal. And it's not, because usually when they feel that, it's a trigger point
Right.
or some kind of muscle tension in that area. There's so many different reasons why a woman would have pain with sex. So there's something called vaginismus, which is an actual clinical diagnosis where the woman actually feels pain as soon as insertion kind of begins, right? So the muscle at the beginning of her vagina is actually very, very tight, very tense. And that's where she starts, as soon as, you know, the insertion begins, there
Right.
is pain. Sometimes they can't even go past that because it's almost, they describe it as like hitting a wall
Right.
because the muscle is so tight.
Right.
But these are things that are fairly common, but we're just not talking about. Like we're not bringing light to that.
Yeah,
You know?
definitely. What about positioning or repositioning your uterus? Is that a thing? Like, can you do that?
Like what do you mean in terms of sex or?
Yeah, yeah, in terms of sex.
So sometimes if a woman has like a tilt, what they call is like a tilted uterus, right? Which only means like the uterus is just positioned, you know, more back, right? Um, doesn't do anything really to her per se. It's just the positioning of it. But when
Right.
we have sex, certain positions, because of the position of your uterus, could actually cause pain. So if a woman comes into the office and they tell me, you know, my doctor just recently told me that I have a tilted uterus, you know, when I am doing certain positions, I am having, you know, pain and discomfort, then I will go through with them what positions work best, how they can incorporate like more support, like pillows, to kind of decrease some of the discomfort and pain that they might be going through.
That's good to know. I think a lot of people should just pay attention to their body when it comes to that. How can therapy help? Like, what kinds of therapies are there that are available under when we're thinking about our pelvic floor muscle?
So definitely pelvic floor therapy, right? Because they're the ones that are gonna they have the skill and the eyesight to know like what's going on with your muscles. But I often refer to acupuncturists and especially chiropractors because sometimes, like I said, it's that chain, that chain makes a difference. So I would say maybe 65% of my patients, I often co-treat with a chiropractor.
Ah,
And
that's
it
good
and
to know
it
too.
actually works pretty good. We get our goals a lot quicker. Um, and it's more conducive because you're not, it's never just in one spot. You know what
Right,
I mean?
right.
So, and no one's really good at posture. I'm not even
Yeah,
good at posture, right?
yeah,
So half the time it's like you're looking down with this cell phone.
yeah.
So now we have all these restrictions that are occurring like right here. You know how many
Yeah,
times
I'm living it right now.
I mean?
Yeah. Especially
So
the last year and a half, we've all been on laptops and iPads,
computers.
computers, so and the amount of hours that we've been on those things, so for sure.
So I definitely always refer out to like a chiropractor because I can't adjust those vertebrae.
Right.
They can. So if they're working with like a good posture, then we have a good foundation when we're starting to do stuff with like pelvic floor.
Wow. I feel like I learned so much today, Nicole. No, I do because I feel like you think you think and you think like, oh, I read a book or I saw my doctor or whatever. And like I said, it's not until things start happening to your body or somebody closer to you where you're like, okay, let me have these conversations or let me think if these things are even connected in life, and a lot of people don't. They're like, oh well, this is happening to me, but I didn't think it was X, Y, and Z, and not understanding that we have to put all of those things together when we think about taking care of ourselves, both as women and as men.
It's hard. Like on average, a woman that is, having pelvic floor dysfunction, sometimes it can take her up to 7 years to finally figure out that that's what she's suffering with.
Wow, that's a long time to be in pain or just to not know.
It's
You
hard
know?
because, we're trained to kind of treat the symptoms, right? So you go to the doctor and you're like, I have this, I feel this way. They're going to
Mm,
treat you by your symptom.
mhm.
But then we're not talking about like, how can we fix that?
Right,
Or
right,
why? Why is it like that?
right. It's
Like
just
with
yeah,
diabetes, like you can have a diabetic go see a doctor and we're going to tell them, take this medicine, do this stuff, but there's so little education when it comes to diet. And
right,
that's like the most crucial part for them
right.
because
Yeah,
all the regulation power is going to come from how they regulate that diet.
yeah. It's kind of like we give a band-aid instead of fixing what's underneath. Totally agree. Totally agree. Well, thank you, Nicole, for like dropping all of this knowledge on all of us. I definitely think that both men and women will benefit from listening to this episode and kind of reflecting on themselves and whatever it is they need. How can people find you?
I actually have an office in Stony Point. I work out of North Rockland Chiropractic.
Oh,
So
nice.
we kind of joined forces in a way because we were referring to each other so much. We were like, might as well just put everything in the office.
Right.
So I have an office there 3 days a week, but then I also offer mobile services 2 days a week. So I go and I service Rockland County.
Excellent. And what does that therapy look like? Is it like stretching? Is it like, I
Yeah.
don't know. What is that? If I what is someone's therapy experience like when they get um, you know, pelvic floor therapy?
It's a mix. So if the person is having like tension, right? Let's say they're more on the shortened muscle side, then we'll go through stretches, right? Specifically stretches that are going to be geared towards the pelvic floor, your hips, your glutes, more of the areas in that region. But I've also worked on core stuff. If a woman comes to me and she has a scar from a C-section, I will work on that. And I use cupping, scar massage, because sometimes that can cause restriction in movement. I treat pain, so I usually will do cupping with my patients. If a muscle is kind of tense, I also do the cupping to kind of it's not like traditional cups. So I know
Right.
like we're used to like applying it and just letting it sit. I apply the cups, but I'm moving them. And then I have
Okay.
you also do movements, right, to kind of shorten and lengthen the tissue. So we're kind of manipulating the muscle
Right.
to get it
Excellent.
to kind of lengthen. I take my clients running. We've done squats, lunges, deadlifts,
Yeah.
like whatever it is that they're lacking or they need to strengthen, then that's kind of what we go through. In terms of looking at like the pelvic floor itself, there is, an outside assessment where I kind of basically look at the whole entire vaginal area, rectal area, and I'm assessing, for color of the skin, make sure that the skin integrity is good, hair growth in that area. I will also test the muscles in that area, right? So if
Right.
there's any particular point where the woman is like, that's kind of tender, then I will do manual therapy to kind of help release that, right? Because if it's tender out there, it's probably tender inside as well.
Right.
When it comes to like an internal assessment, I use one finger. They're not, up in stirrups. So it's not like that whole GYN kind of experience.
Right.
Um, there's usually a sheet covering them because I really don't have to look at that point.
Right.
And I am kind of looking for all their muscles in that area. And
Excellent.
I usually treat as I go. So if I'm doing an evaluation and I find something, I will do manual therapy right then and there to treat it, and then I move on.
Excellent. Well,
So
that's
that
good to
way,
know.
yeah.
Yeah, that's interesting. And how long does therapy last for some people? Like what's the minimum amount of therapy you need in order to make this change to your body?
It depends honestly on a lot of things. So one, it depends on what's going on and how many problem areas we're actually treating. Two, it depends on how much time you have.
Right.
Right? So I don't like to put pressure on my clients either. So, yeah, ideally it would be good if you can do this program for X amount of days, but if you have a full-time job and a brand new baby, that
Right. That's
may not
hard.
occur, right?
Yeah. Yeah, that's hard.
We have to kind of modify to, so I kind of meet them where they are instead
Which
of
is very
telling.
fair.
Yeah, because everybody has a different life. Like, you don't know what's going on at home. And this process is not supposed to be something that makes you feel guilty, that, makes you add more stress onto your life that you already have. Like, this should be the time where one, you get to decide your goals, your treatment. Two, you get to, be empowered with education and work on actually like boosting how you feel.
Right. Right.
because you're empowered with the knowledge that you have.
Yeah. And
So I
heal.
don't stress them out. But the shortest patient I've ever had was, I would say, 9 visits with me, and she was pretty good.
That's not
She was,
bad.
yeah.
That's not bad. 9 visits, that's pretty good.
But it
That's
depends, like,
yeah.
what, because for her, it was more, she had a spasm every time she urinated. So it was just maybe 3 problem areas, 2 or 3 that we were working on. So it went a lot quicker.
Right.
So it
Right.
depends, like, on a lot of things, right? Because it's not, you're coming to see me 1 time a week for 1 hour, but you
Yeah.
gotta go home and put all of this into play.
Right. Right. Yeah. And it depends, like you said, on what your needs are. Some people have minimal amount that they need, and other people they might have more. And so, you got to take that into consideration. That's amazing. How can all of my listeners find you and seek you out if they need you?
So Pivotal Performance is actually on Facebook.
Yay.
Yeah. And if you want, you guys really should. So I started Rockland Women in Wellness. It's a collaborative group of healthcare professionals, right? So we have a Facebook group, and I would say monthly, we always do lives that you're not going to see anywhere else. So you're not going to see these things like on my Facebook business page or my Instagram. Like, this is just for you. And there is no solicitation whatsoever. I have other, wellness professionals in the group, other business women in the group. Um, Education.
Yeah.
That's
Sure.
my goal. Don't solicit, but teach. Teach people something that they don't know. So that's what I really wanted to create the group for. So if they want, they could always join. And I have a link in my Instagram page
Oh, great.
that they can find the group a lot easier.
Yes, thank you. Tell them your Instagram.
My Instagram, oh my goodness, you are not gonna, I don't know how to find my address. I'm gonna,
We gotta find the Instagram page. I thought it was Pivotal Performance, but I'm sure you can look for
yes,
it.
it's Pivotal Performance OT.
Yes. So I
I'm so
follow.
like tech savvy.
I follow. I think that everybody should look. I think men, I think that you should look and understand and learn. Women, I think you should do your research and pay attention to your bodies and kind of visit Nicole's website and just kind of see the information there. And if it applies to you, great, you have a resource. And if it doesn't, it's something to share with someone else.
Right.
And that's what we need to do. We need to be sharing information so that people have the resources they need to be informed and to make the best decisions that they need to make for their self. Thank you so much, Nicole, for being here. I learned a lot. I'm not gonna do Kegels anymore, but you got to give me something else. Yeah, and so that I can exercise down there. Because I don't want it to get old. And you should definitely. I'm serious. You should definitely come back again when you launch for the guys, so that we can focus on the guys and share some conversation about that.
Definitely. I would love to.
Thank you so much.
You're welcome.
All right, hold on.